Welcome. Come with me. The doctors will see you now.
Welcome back to Fast Talks with Family Docs. I'm Dr. Veer Vidala.
And I'm Dr. Phil Palmer.
Today we're talking about something that doesn't come naturally to us in medicine, being kind to ourselves. Not in a soft, abstract way, but in a structured, evidence-based way that turns out, having real implications for burnout, for patient care, how we show up in the exam room every single day. Our guest today is Dr. Sarah Schumann, a board-certified family physician, a lifestyle medicine physician whose path has really taken some interesting turns. She's also a trained mindfulness teacher, a certified health and well-being coach, and an advanced therapeutic yoga instructor. She has trained in mindful self-compassion, a structured evidence-based curriculum, and has led programs for physician groups, including residents at OU Tulsa and her colleagues through the Oklahoma chapter of the American College of Physicians, or ACP. Dr. Schumann, we're so glad you're here. Thank you for joining us today.
Yes, indeed.
Thank you so much for having me.
Dr. Schumann, most family docs who build an expertise outside of their practice of medicine, of clinical medicine, usually have a story behind that, and it may often be a hard, difficult thing that prompted them into that second area of life. I'm wondering if you would share with us what drew you towards mindfulness, yoga, and health coaching. Was there a particular turning point in your life that started you on this journey?
Yeah, I love that question, and I love that you acknowledge that there is often something hard. I will say my interest started early, back when I was in medical school. I would say I dabbled in mindfulness and yoga for a couple decades before I got much more serious about it. But when I was back at Harvard Medical School in the 1990s, I took a fourth-year elective with Dr. Herbert Benson, who's known for, I would say discovering the relaxation response, but not really discovering it, but kind of taking this, these meditation practices that, of course, have been around forever in other cultures, but really starting to do some basic science research on what happens when you do, breathing exercise and meditation, and showing how heart rate and blood pressure can decrease. And it's, basically kicking in that parasympathetic response, but showing that there are beneficial clinical outcomes. So I took a month-long course with him. And then when I was on the faculty at University of Chicago, I was that faculty member who would come out like at the beginning of third year, when all students were so excited to get into their clinical rotations, and they're like, oh, now we have to do breathing exercises with Dr. Schumann. But so I was kind of, I would do that. But also my husband and I were able to teach a course called The Healer's Art, which was started by Dr. Rachel Remen at UCSF. And it was really a way to help students. It was first-year med students, to help them keep that humanity and that compassion that drew them to medical school, and that sadly is often kind of beaten out of people with their clinical training. Right. And so we did that, and we did a Finding Meaning in Medicine group for faculty. So this has definitely been an interest for a while. And then I think, after the move to Oklahoma, it kind of, I was very involved in medical education, and, I continued to work in community health centers, and I wasn't really doing much with it. I think when the pandemic hit, I was actually doing full-time urgent care telemedicine in 23 states, and which was hard. It was really, really hard. And on the side, you'll see this theme that I either call myself a training junkie, or the kind self-compassionate way to say it is that I am a lifelong learner. And so during the pandemic, while I was in that job, I did my 200-hour yoga teacher training, and I did the first of these 3 mindfulness teacher trainings that I had done. It was called the Mindfulness Meditation Teacher Certification Program. That was a 2-year training. And I also started doing my lifestyle medicine training for those boards. So those were, I was kind of just doing it on the side, because I'd always been interested in talking to patients about diet and exercise and stress.
Right.
And I think the yoga teacher training was more kind of to deepen my own practice, I'd always wanted to do more yoga. But I started teaching mindfulness with that. And then you mentioned the hard thing. So then the hard thing happened, which is 2023, 24. We had some stressful things in our family. I had some family members who were dealing with some pretty severe depression, and we had an elderly family member who wasn't doing well. And it was a really hard time. And, as people say, based on the title of that book, the body keeps the score.
Yeah.
And when things were stressful, and I was also in a stressful job, more of a corporate medical job and on the payer side then, I started having my own body issues. I was having severe hip and back discomfort, went through a couple different diagnoses, but like so many family doctors, and I was diagnosed with an autoimmune condition. So it took a while to get it, but I have axial spondylitis, which wasn't something I was familiar with as a doctor. And my body needed me to be doing this gentle yoga practice and this mindfulness and kind of to slow down. And I ended up taking a leave from my job. I was a chief medical officer of one of the new Medicaid managed care plans. I took a medical leave and went and did a month of yoga therapy training at Kripalu, which is a yoga center in Western Massachusetts.
Whoa.
And it was great to kind of take that time for myself and think about, I wanted more knowledge. I wanted to see how could I really help people with medical conditions through the different practice, not just yoga postures, but breathing exercises and meditation. And I'm learning about Ayurveda. And so that was the hard thing that led me to do more. And during that time, I also discovered this thing called mindful self-compassion, which is an 8-week course in mindfulness, really teaching people how to treat themselves the way they would treat a really good friend. And that was sort of life-changing for my own practice. And I thought, wow, this is something I could really, I would love to share with others.
Yeah.
So I ended, so I'm the kind of person that takes a training or takes a course or goes on a retreat and then immediately signs up for the teacher training. So that's what happened with mindful self-compassion.
Well, thank you for sharing that with us.
Yeah. Oh, Dr. Schumann, what a fascinating story and what an amazing journey you've had. I guess I got a follow-up question. When we're trained as medical students or residents or family physicians or kind of geared towards a specific way of looking at medicine and teaching and treating patients, and this is our thought process, and it's kind of hard for us to I guess take like a huge zoom out and look at all these other integrated approaches of treating patients. And you've been, to places like Harvard, and you've been faculty at several academic centers. How were you able to kind of separate those identities and incorporate this mindfulness and this coaching aspect of helping your patients from that clinical doctor perspective? You know what I mean?
Yeah, that's so interesting. I mean, it's something as a medical educator, I want everyone to do. And I think, thinking as someone who's served on admissions committees, people are coming with science backgrounds, but they are coming with these big hearts that really people really care and they want to help people. And I do think, sadly, so many doctors lose sight of that during training and during, they sort of get it beaten out of them, which is really sad. But interestingly, I always say I came to medicine from service, not science. In college, I was a history and literature major, and I did a ton of community service. And I took time off, so I hadn't done pre-med. I took time off after college to figure out what I wanted to do with my life. And I realized I wanted some kind of additional training because that's, clearly the kind of person that I am. I love to learn. I wanted to develop a skill. But I really wanted to be an extension of the community service I'd been involved with. And I took time to shadow different people, like in public interest law and public health and social work. And I found a family doctor at a community health center. And I thought, well, this is kind of perfect because it's a skill, and it sort of combines education and social work and science in this really interesting way. And that's when I went back and did my post-bac pre-med. So I would say that for me, it was never really separate. And I really do think for most people who go into medical training, and then as a patient now, I do a lot of things for my health. Like, I do meditate and I do yoga and I, try to eat an anti-inflammatory, mostly plant-based diet. And I'm on a biologic injectable once a month. And that's what I needed. I got to the point where there was a day I could not get out of bed, and I had been eating vegan, gluten-free. I'd been swimming, doing yoga, meditating. And it was a really great lesson that I couldn't lifestyle my way out of this thing. I needed to go see a rheumatologist, get a diagnosis and get some treatment. And I think the reason I'm doing so well now is because I do combine these things. And it's really what integrative medicine is. Yeah. So it makes so much sense to combine conventional medicine with these complementary therapies. And it's how I like to practice. It's how I am as a patient. And it's really why I went into medicine in the first place.
I think I needed to hear that, Dr. Palmer. It doesn't have to be either or. It can be both.
Right.
That is great. Thank you, for sure. That's
definitely.
wonderful.
So, Dr. Schumann, I feel like when I was in medical school, it was very body focused, but we know that the people we care for and really we ourselves are mind, body, and spirit. And so if we're just focusing on the body, we're missing 2/3 of what's at play in every encounter. And so you've kind of taken paths that lead you to address that mind and spirit aspect. I feel like residency programs over the last decade to 2 decades have begun to incorporate this, some more effectively and more efficiently than others. But from your perspective, what do you think is necessary for docs already in practice or students heading into family medicine and the rigors of a residency to integrate tools like mindfulness into their daily lives? Do you see there are specific obstacles that might need to be overcome?
Yeah, I think the main obstacle, if you asked people in practice, why aren't you doing this yourself and why aren't you doing it with patients, they would say probably knowledge. Maybe they don't know that much about, breathing exercises and meditation, and then time, but I don't have time to do it. I don't have time to do it with my patients. And I think those can be true,
Sure.
And I think one of the things I've learned as a meditation and a yoga teacher is we teach best what we know from our own practice. So and if you think about it, think about the studies that talk about, when doctors counsel on weight loss, for example, or, physical activity, patients can see us. They know if we're doing these things ourselves.
Yeah.
So, if you're practicing a healthy lifestyle, right, you're exercising, you're eating a healthy diet, it's much easier to counsel patients about that, so from your own experience. Yes. And it's not that they need to do exactly what we're doing or they can do everything we're doing, but it means so much more to patients if if you have that experience. So I would say same thing with mindfulness. I'm also a mindfulness-based stress reduction teacher, but mindfulness-based stress reduction, which has lots of evidence, right? It's been around for decades. Mm-hmm. They're asking patients to go through an 8-week class where they're practicing mindfulness 45 minutes a day. And, the majority of people in the world don't have 45 minutes a day to do that. So I don't teach that course very often because it's really hard to get people to sign up, even though it works incredibly well. But one of the things I love about mindful self-compassion is it's much more compassionate about what it's asking people to do, which is really learning these practical exercises that you can apply in a minute or two. And so I think it's really helpful for trainees and practicing doctors to start to learn some of these things. Maybe it's breathing exercises for a minute, right? And maybe it's learning how to just sit with your breath and practice meditation. Start with a couple minutes. It doesn't have to be anything that's a huge time commitment. I mean, as I do certain practices in bed before I touch my phone in the morning, before I get out of bed, but it might be 3 minutes. And I do a gratitude journal at night. But like, as you start to figure out what works for you and you start to develop these routines and you see that it's helpful to yourself, then you're more able to share these kinds of things with patients in a way that's credible, and more likely to actually help them maybe change some of their own habits. So and I just want to say, it doesn't have to take a lot of time. I'm actually going on Sunday to another week-long silent retreat because I love those. But you don't have to go on week-long silent retreats to be able to learn how to meditate and see how it can just help improve your quality of life, and then you can share that with others, including your patients.
Yeah.
Excellent. Outstanding. Well, thank you for that. And we're going to take a pause here, viewers and listeners, to wrap things up for this episode. But we will be back with more discussion with Dr. Schumann next time on Fast Talks with Family Docs.
Thank you for joining us today. The doctors would like to see you back for another check-in. Please choose to follow our podcast and you will automatically be notified when it's time for your next appointment.